Old age is the stage when people want to rest and enjoy life with their children and grandchildren after many years of hard work. However, this is also the time when the body begins to decline in many functions, especially memory and thinking ability. Among the common health problems in the elderly, Alzheimer's disease is becoming a serious threat, not only causing intellectual decline, but also severely affecting the patient's quality of life and independence. Alzheimer's is not simply a phenomenon of old age forgetfulness, but a form of progressive dementia caused by damage to nerve cells in the brain. According to statistics from the World Health Organization, WHO, there are currently more than 55 million people worldwide living with dementia, of which Alzheimer's disease accounts for about 60 to 70%. This number is expected to increase sharply in the coming years, especially as the population ages rapidly. What is worrying is that many people are still not fully aware of this disease. They often ignore the early signs, mistaking them for normal aging symptoms, leading to delayed diagnosis and intervention. Therefore, understanding the causes, consequences, and prevention of Alzheimer's disease is extremely necessary, not only for the elderly, but also for their families and the whole society. In this article, we will learn in detail about Alzheimer's disease, a serious warning bell for the mental health of the elderly, to raise awareness and be more proactive in prevention and care for the sick. 1. What is Alzheimer's disease? Alzheimer's disease is a form of dementia that causes a decline in memory, thinking, language, and behavior. This is the most common form of dementia, accounting for about 60 to 80% of cases. People with Alzheimer's disease will gradually lose the ability to remember, communicate, take care of themselves, and even lose the ability to recognize family members when the disease is severe. Backhand index pointing right note. Alzheimer's is a disease, not a normal manifestation of the aging process. 2. How does the disease progress? Alzheimer's disease progresses slowly over time, usually lasting from a few years to more than 10 years, divided into 3 stages. Early stage, mild forgetting recent events, difficulty finding words to express, loss of concentration. Middle stage, moderate forgetting the names of relatives, disorientation in space and time, difficulty in daily activities. Final stage, severe complete loss of memory, difficulty speaking, completely dependent on caregivers. 3. Signs of Alzheimer's disease. Early recognition is very important for timely intervention and treatment. Below are 10 warning signs that the elderly may have Alzheimer's. Forgetfulness affects daily activities. Forgetting things that have just happened, forgetting appointments, asking over and over again. Having difficulty planning or solving problems. For example, not remembering recipes when cooking, not being able to calculate daily expenses, having trouble with familiar tasks, not remembering how to use a gas stove, confused when driving or dressing, confusion about time and place, not remembering what day it is, often getting lost near home, difficulty understanding images and space, difficulty reading, poor judgment of distance, frequent falls, difficulty speaking and writing, unable to remember words, hesitant in conversation, messy writing, misplacing objects, not remembering where they were, putting wallet in the refrigerator, leaving keys in the rice cooker, reduced ability to judge and make decisions, unable to distinguish money, easily deceived, withdrawing from work and social activities, not wanting to join groups, talking less with others, mood and personality changes, irritability, suspicion of loved ones, depression or unreasonable fear. 4. Causes of Alzheimer's disease in the elderly. Overview of Alzheimer's disease. Alzheimer's disease is the most common form of dementia affecting memory, thinking, and behavior. It is a progressive neurodegenerative disease that usually occurs in the elderly and develops gradually over time. Although there is no cure, Understanding the causes of the disease can help prevent and treat it more effectively. Biological causes. Accumulation of beta-amyloid plaques. One of the main characteristics of the brain of people with Alzheimer's disease is the abnormal accumulation of beta-amyloid protein between nerve cells. These protein plaques form plaques that interfere with signaling between nerve cells and trigger an inflammatory response. Disorder of tau protein. In nerve cells, tau protein helps stabilize intracellular structures. In Alzheimer's disease, tau protein is mutated and forms tangles, disrupting the transport activity in the cell and leading to nerve cell death. Loss of nerve cell connections. The result of these two factors is the loss of connections and gradual death of nerve cells, especially in the hippocampus, the area that controls memory and learning ability. Genetic factors. Family genetics. Some cases of Alzheimer's have a strong genetic component, especially those who develop the disease before the age of 65, early-onset Alzheimer's. Genes such as AP, PSEN1, PSEN2 are involved in the abnormal production and breakdown of beta-amyloid. APO, E4 gene. The APOE, a polypoprotein E, gene has three main variants, E2, E3, and E4. Of these, APO, E4 increases the risk of Alzheimer's and is often found in people with late-onset disease, after the age of 65. However, not everyone with this gene will develop the disease. Age, the biggest risk factor. Age is the leading risk factor for Alzheimer's disease. After age 65, the risk of developing the disease doubles every 5 years. By age 85, about 1 in 3 people may have Alzheimer's at different levels. Environmental and lifestyle factors. Poor nutrition. A diet that is poor in nutrients, high in saturated fat, sugar, and low in fruits and vegetables can increase the risk of cognitive decline. Lack of physical activity. Regular exercise helps improve blood circulation to the brain and reduces the risk of neurodegeneration. Social isolation and depression. Older people who live alone and have little social interaction are at higher risk of Alzheimer's disease. Depression is also a factor associated with the risk of cognitive decline. Insufficient or poor quality sleep. Sleep plays an important role in removing waste from the brain, including beta-amyloid. Poor sleep can promote the buildup of these plaques. Underlying diseases and brain damage. Cardiovascular disease and high blood pressure. Cardiovascular diseases such as atherosclerosis and high blood pressure reduce blood supply to the brain, increasing the risk of Alzheimer's. Traumatic brain injury. People who have suffered a serious head injury, especially if they lose consciousness, are at higher risk of developing Alzheimer's later in life. Diabetes and insulin resistance. Type 2 diabetes may increase the risk of Alzheimer's disease, as it is linked to damage to blood vessels and insulin resistance in the brain. Education and mental activity. Studies show that people with low levels of education or who do not maintain regular mental activity are at higher risk of Alzheimer's. Reading, playing chess, learning a new language, or engaging in other intellectual activities can help reserve the brain's cognitive resources. 5. Serious consequences of Alzheimer's for the elderly. 1. Severe memory loss. One of the most obvious manifestations of Alzheimer's is memory loss. Patients often forget recent information, do not remember the names of relatives, do not recognize where they are or why they are there. This condition not only causes confusion for the patient, but also makes the family worried and tired in caring for them. 2. Decreased cognitive function and communication ability. Alzheimer's affects the ability to think, analyze, judge, and solve problems. Patients often cannot perform tasks that require thinking, such as planning, doing housework, managing finances, or even choosing the right clothes. In addition, language and communication skills are also affected. Patients have difficulty finding words, forming sentences, or understanding what others say, leading to social isolation. 3. Behavioral and emotional changes. People with Alzheimer's can have sudden and unexplained changes in behavior. Common symptoms include anxiety, restlessness, irritability, depression, or repetitive behaviors. Some cases also have paranoia or hallucinations. These changes directly affect the quality of life of the patient as well as the caregiver. 4. Loss of self-care. When the disease progresses to a severe stage, the patient almost completely loses the ability to care for themselves. They need support in all activities from eating, bathing, dressing to personal hygiene. This puts a lot of pressure on the family and caregivers, while reducing the patient's dignity and independence. 5. Increased risk of other diseases and death. People with Alzheimer's often have chronic diseases such as high blood pressure, diabetes, heart failure, depression, etc., but have difficulty complying with treatment due to memory loss and lack of awareness. In addition, they are also at high risk of falls, malnutrition, pneumonia due to aspiration, etc. These factors make the mortality rate in Alzheimer's patients significantly higher than that of normal people of the same age. 6. Social and financial burden. Alzheimer's not only affects the individual patient, it also places a great burden on the family and society. The family has to spend a lot of time, effort, and money to take care of the patient. Meanwhile, the health system is also under great pressure to provide treatment services, long-term care, and psychological support for patients and their relatives. On a global scale, Alzheimer's causes hundreds of billions of dollars in damage each year. Conclusion: Alzheimer's is a serious and dangerous disease, especially in the elderly. The consequences of the disease do not stop at memory loss, but also comprehensively affect the physical, mental, and quality of life of the patient and those around them. Raising public awareness, early detection, timely treatment, and building programs to support the elderly are extremely necessary to minimize the severe impact that Alzheimer's causes. 6. Alzheimer's disease prevention measures. 1. Regular brain training. Participate in intellectual activities such as reading, playing chess, solving crossword puzzles, Sudoku, learning new skills. Maintaining lifelong learning helps stimulate connections between nerve cells. 2. Increase physical activity. Regular exercise such as walking, swimming, yoga, and aerobics helps improve blood circulation to the brain and reduce stress. Encourage at least 150 minutes/week of moderate exercise. 3. Healthy diet. Eat according to the Mediterranean diet. Lots of green vegetables, fruits, whole grains, fish, olive oil. Limit sugar, saturated fat, and processed foods. Supplement foods containing antioxidants such as blueberries, walnuts, turmeric, curcumin. 4. Control underlying diseases. Treat high blood pressure, diabetes, dyslipidemia, cardiovascular disease well. Regular health checkups to detect brain-related problems early. 5. Get enough quality sleep. Sleep 7 to 8 hours per night. Avoid staying up late. Limit caffeine and use of electronic devices before bed. Prolonged sleep disorders can increase the risk of amyloid plaque accumulation. 6. Stay positive. Avoid stress. Participate in community activities, groups of friends, classes for the elderly. Meditation, yoga, deep breathing, and psychological relaxation therapies help balance the mind. 7. Limit risk factors. Do not smoke. Limit alcohol. Wear a helmet when riding a motorbike to prevent head injuries. Ensure a safe living environment and limit falls. If diagnosed with Alzheimer's, patients can still live actively and slow the progression of the disease by 1. Taking medication as prescribed. Drugs such as donepezil, rivastigmine, memantine can slow cognitive decline. Coordinate treatment of comorbidities. 2. Cognitive rehabilitation. Participate in cognitive training, speech therapy, and physical therapy if needed. 3. Support from family and community. Provide a safe, familiar living environment. Help patients maintain daily routines. Be patient and communicate gently and clearly. 7. The role of family and community. Family is an important spiritual support to help the elderly cope with Alzheimer's disease. Alzheimer's disease not only affects the person with the disease, but also has a profound impact on the family and surrounding community. As memory and cognitive ability gradually decline, the patient becomes increasingly dependent on the care, companionship, and emotional support of loved ones. In that context, the family becomes a solid spiritual support, a shield to protect the elderly from isolation, anxiety, and rapid progression of the disease. Family, an important spiritual support. Daily care and support. Alzheimer's patients often have difficulty with daily activities such as eating, bathing, taking medication, or remembering time. The presence of family helps maintain routines, provide medical support, and ensure safety in the living environment. When living in loving arms, patients feel secure, less afraid, and limit disordered behaviors such as agitation or depression. Communication and emotional bonding. Regular communication with relatives helps patients stimulate the brain, retain familiar memories, and reduce feelings of loneliness. Gentle conversations, recalling old memories, or looking at family photos together can stimulate memories and bring joy to life for patients. Psychological and emotional stability. Care, patience, and understanding from relatives help patients feel that they are still valuable and loved. Family plays an important role in regulating psychology, helping patients avoid depression or confusion due to memory loss. Monitoring and coordinating treatment. Relatives help monitor the progression of the disease, remind them to take the right dose of medication, take them for follow-up visits, and maintain a healthy lifestyle. They are also an important bridge between patients and medical staff, helping the treatment process to be more effective. Community, an expanding supportive environment. Create conditions for social communication. Elderly people with Alzheimer's often withdraw from society due to concerns about memory loss. However, participating in community activities such as senior clubs, health classes, or charity activities will help them maintain flexibility in thinking and feel connected to society. Building a friendly and safe living environment. Communities need programs to raise awareness of Alzheimer's disease to avoid stigma and provide timely support when needed. Smart urban designs, clear signage, accessible public spaces also contribute to making life easier for patients. Support for caregivers. Families cannot shoulder the entire responsibility of caring for patients without support from the community. Counseling programs and mental support groups for caregivers help them share experiences, learn skills, and avoid physical and mental exhaustion. Cooperation between health, society, family. A comprehensive care system for people with Alzheimer's disease requires coordination between medical facilities, social organizations, and local authorities. Organizing regular health checkups, early detection of the disease, education about elderly care, and providing home support services will help reduce the burden on families and patients receive the best care. Conclusion: family is the spiritual foundation and the only place that can give unconditional love to the elderly with Alzheimer's disease. With the support of family and community, patients will live in a positive environment, minimizing psychological damage and slowing the progression of the disease. Let's build a compassionate society where the elderly with Alzheimer's are not left behind, but are loved, respected, and cared for properly. 8. Alzheimer's disease is not only a personal health problem, but also a major social challenge in the context of a rapidly aging population. With its characteristic of progressing silently, but causing serious consequences. This disease has been robbing the memory, personality, and independence of millions of elderly people around the world. Although there is currently no cure for Alzheimer's, early recognition of signs, healthy lifestyle changes, proactive periodic health checkups, and especially care and understanding from family and community can help patients maintain a better quality of life, while slowing down the progression of the disease. Each of us, whether we are children in the family or those entering their twilight years, can proactively prevent and join hands to build a friendly and positive living environment for the elderly. Let's consider protecting the mental health of the elderly as a responsibility and love that needs to be shown every day. Backhand index pointing right. Let's start today, so that old age is no longer a worry, but a time of joy and full memories.